Phil Morrissey, registered osteopath. Welcome to IGTV, the Osteopath Clinic Croydon. Okay, so we're sharing with you a very simple exercise that I see in the gym. This is particularly for Cinderella, Paul and two ladies that I saw in the gym yesterday trying to do the dead bug. So we give this exercise in clinic for patients that have got recalcitrant back pain. And they're just simply not getting anywhere. They may have sacroiliac dysfunctions, they may have old discs, some muscular imbalances, and or post-operatively, we've seen a number of patients with this. And this is I've called this in the past Pilates secrets or back pain secrets, but it's a very, very good exercise. It's recognised within the trade as being one of the better exercises. Dr. Carolyn Richardson gave us this idea probably about 15 years ago, using ultrasound by way of actually testing whether our deeper stabilisers are firing. Now this is a very, very simple technique. We're using essentially a blood pressure cuff so that we can in fact use biofeedback to see whether we're actually firing the muscles correctly. So there are four muscles that we're trying to fire up in its basic in its origin, okay? So Ria, one of my Pilates teachers and sports therapist, she's going to demonstrate this. We're using Carolyn's actual cuff, but it's exactly the same as your regular blood pressure cuff. You can get it from £10 on Amazon. So we are generally looking to get four muscles to work, and that essentially is the transversus abdominis. We're trying to get the pelvic floor and the multifidus, and then this big muscle here, the diaphragm. So we can kind of simplify this, and in the past I've tried to explain this and made it far, far too complicated. So essentially we're actually getting ourselves into a neutral spine. We are pumping this up to 40, okay? Now if we push the lumbar spine down into the floor, it's going to go through the roof, the pressure. And then again, if we hyperextend and release contact with the floor, it's 0. So we're trying to get ourselves into a base, a neutral base, so that we've got an effective area to work from. So it's a very safe, effective position to work from, your neutral spine. It varies from one patient to another. So the first thing I would say is that we see a number of Pilates teachers with this, and they have a massive over-recruitment of the transversus abdominis, all right? So it may be that someone's blown a disc, and when you blow a disc, we actually lose the multifidus, and that's one of the tiny muscles that has a massive, profound effect on stability for your spine. So it may be that we're trying to go for the back as our major recruitment, okay? So we're getting that tactile information, you know, from this. So you're actually feeling that if it was your multifidus, your back muscles are swelling. Pelvic floor, there may be some incontinence issues as well. So these all muscles all work really, really well. So here's the trick with this exercise. So breathe in, breathe out. Now empty all the air out of your lungs. This is done very, very nicely. Okay, so from here now, your short and curlies, you're pulling them up into your abdominal area, okay? And then let it go, all right? And again, so from here, breathe in, breathe out. Ladies, from this position now, you're going to, the sensation of stop urinating, but keeping the spine in this neutral position, all right? Most people tuck under at this level, okay? So now we're getting into the car, we've put the ignition in, we've released the gears, and now we're going to start doing a little bit more. So now we're going to bring the diaphragm into play. So from here, we breathe in, breathe out. So this is very quiet. Imagine you've got a nice glass of red wine here and you don't want to spill it. Pelvic floor is engaged nicely. Transverse abdominis is engaged. And now we're going to breathe sideways. So it's just like an accordion. So you're bellowing out this way, not your yoga breathing. This is apical breathing. It's very important to breathe sideways. You can all be sitting down like this and breathing out sideways, just not going up into your neck. All right? Now we're nearly there. It seems really complicated, but it is not, okay? Because you have this. Because if you lose the 40, you know that you're not quite getting it right. So that will give you this biofeedback to whether things are working correctly. So now, for your back sufferers, it may be the multifidus, the back muscles that we need to get. So this is really simple. Again, breathe in, breathe out, empty all the air in your lungs. Pelvic floor recruitment, stop peeing. Now with the back muscles, we may feel that we need to make them swell. That's a nice term that we use for this, a thickening, a swelling of those back muscles, keeping an eye that it's 40. Now you're breathing nicely, diaphragm's engaged, everything's working really well. So that's your base unit, 5 breaths, 5 times. Guess what? We have to challenge it. So from here, whether it's, you can just use this, it's for the 40 and you're very happy with your back, it could be your pelvic floor as a major thought process to get this engaged. So from here now, we're going to challenge this. So breathe in, breathe out. So this is very quiet. Pelvic floor recruitment. Back muscles are swollen. Now from here, you're just going to lift the heel off the ground and see whether that changes. And then lower. Good. And again, breathing in. Out. Lovely. Now let's change the legs. Okay, so it can just be an inch off the ground. So we just don't want, you may find that the dial goes haywire. Alright, so, and look, now from here we're going like so, into a tabletop position, 1990, traditional position. Now, we have to really reinforce that we are swelling these back muscles for the recalcitrant back, sacroiliac problems, because this looks great here, but it may not be right the other end. Okay, so from here now, we're just going to drop down to the floor and then come back up, just so we're getting this nice disassociation through the hip. So we've got femoral disassociation, arcing, there's lots of different names for this sort of procedure. Good. Just watch this side that we're working really hard. Okay, so then we're going to do the other leg. So we come back up, don't let the dial, bring the knee up to 1990. Wonderful. Good. Now Rhea's working very nicely here, okay? So now this one's just going to, the toes are just going to drop down, touch the water and come out. So we're just getting this nice femoral disassociation. Wonderful. So, without taxing Rhea any further, this can now come into the dead bug. So little arms like so. So we're keeping an eye like so, breathing in, breathing out. Good. It may be the pelvic floor, maybe the back. Just make sure that the pressure is correct on 40. So now we're going to let the left arm go above the head and the opposite will come down like so. Good. And then up you come. So now we've got the makings of the dead bug. And it's, look, we're working hard. Dig deep into the stomach. Make sure this is working here. Really simple, then you can just simply swap this over. Now, there's one further challenging exercise that I like to share with patients, which is good for the osteoporotic patients, patients with neck pain that we need some core strength. Okay, so from here now, this little leg's going to go about 45 degrees. This hand's going to go like so. Quiet. We're digging deep into the abdominal muscles. So we should have this found by now. Now we're just simply pushing the knee against the hand. Push, 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 push. Without challenging. Woo! We are training here rather nicely. Hold it for 5. Do this again 5 times. So that's a nice way of actually getting to grips with some of this recalcitrant back pain, post-surgical. We're sharing this with you today. I'm sure you'll get some benefits. Always talk to your medical officer, your osteopath, your physiotherapist regarding these exercises, because they are excellent if done correctly. It's about control. And then for sure, we like patients to move and jump about, but there's a time and a place. And for some things that slip through the neck, some of the little discs, the facet problems, the sacroiliac joint issues, that last exercise is great for osteoporosis. You know, you can have a lot of fun from this. So 5 times, repeat it 5 times, so it's 5 times breath, repeat these 5, and you can do them 5 or 6 times a day, and you'll get a lot of benefit from this. So here's from the Osteopathic Clinic Croydon, it's Rhea with me. She's worked really nice and hard, so I hope this is of help to some of you. Thank you.